So this is obviously a team of women runners. The text on their shirt says too fat to run, or actually it's ended with a question mark. So is it too fat to run? That's actually a really good question. This is going to be on the this video is going to be on the impact of cardiovascular fitness if you have a bad diet and if you're obese. That's actually two different questions, and I'm going to cover a couple of articles which came out of the same large study, the ACLS, Aerobic Center for Longevity Studies, I think. But again, it dealt with both of these issues. What impact does cardiovascular training have if you eat too much and you're too heavy? Now, let's go back and talk about this. This was actually raised by a series of videos I did on the Lancet studies for low carb. For those of you who are not familiar with it, the media reported this as low carb diets decrease your lifespan. Well, the reality was a lot more complicated. Like I love to say, it's just not that simple. At the end of several videos analyzing the details, I am not getting off my low carb diet, I can tell you that. As you can imagine, there was a lot of discussion and comments from the viewers. Bambi Abels started some of this comment about the impact of diet and obesity and exercise. Bambi's been with us for a while. The real key regarding what is done with a high starch, modified, moderate fruit, protein income diet is activity level. If you eat a lot of white potato and bread and sit on your butt 24 hours a day, you will become fat. However, if your activity is a triathlete every day, you won't get nearly as fat. Very true, Bambi. Sylvia Ernst is a new viewer, and she had a different perspective. It's, gosh, Dr. Brewer, this helps me understand why I need to be so involved and determined to get back into my once triathlete type shape. No joke. And I agree with both of you. And again, there's actually some science which deals with these specific questions. And these questions obviously are critical to most of us. Does aerobic or cardiovascular conditioning help? What kind of impact does it have on your health if you have a bad diet and if you're obese? So this is one of the two articles. Again, they both came out of the same study. This was reported in the International Journal of Epidemiology. It's one of the Oxford academic journals. This is the dietary patterns impact. If you eat badly, but you exercise, what's the impact on mortality? Impact of cardiovascular fitness on dietary patterns and the risk of mortality. That is the first study, and in this study, they came up with one primary dietary pattern emerged. It was labeled the Unhealthy Eating Index, UEI. And imagine what that would be. Characterized by elevated consumption of processed and red meat, white potato products, non-whole grains, added fat, reduced consumption of non-citrus fruits. Now, we'll cover what they found in just a minute. But before we do, a brief introduction. My name is Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R. I started off my career as a doc in the ER and got very frustrated with all of the... people coming into the ER tend to bring... The vast majority of it is preventable death, disease, injury, and disability. So this was over 30 years ago. So yes, I am old. I'm over 60 now. But I said, I don't care if I end up being a bureaucrat, which a lot of people did in preventive medicine. I'm still going to go learn prevention because it's about the patients. It's not about what an individual doc does. I went to Hopkins to get training, ended up loving it, did very well, ran the program for a while, and have spent a career over 3 decades of working with primary care docs, staffs as high as 800 and more doctors, primary care docs, and patients and NPs and anybody that would listen, helping them understand the science behind prevention and how to apply that science so that we don't get sick and so that we don't die early. And most of all, so we're not disabled. This channel is a similar thing. It's basically something I'm putting out there to help anybody who's interested to understand the science behind prevention as it continues to develop. Believe it or not, there's a lot of interest. There are, every day, there's about 7,000 views on this channel, learning the science of prevention. I'm using a new taping format. I'm not shaking the paper in front of the video anymore, but I still haven't learned it very well, so please be patient. Now, back to the science. As we start talking about BMI and health, we can go down a lot of bunny trails. One of them, for example, this one is identifying the red flags for unhealthy weight control among adolescents. In other words, obviously the getting into the issue of bulimia. There's a book called The Obesity Paradox. It was written by a physician. I can't remember his name, but it has to do with when getting skinnier gets unhealthier. Obviously, there are times when that occurs, like when you have a cancer. That's relatively common with our geriatric populations as well. Skinny little old ladies, you think, well, that's actually a health risk. But again, that's a BMI below 17. That's loss of 3% of your body weight unintended in a week or more. Again, different issues. Speaking of, actually, we're not going to cover that right now. We're going to go to, speaking of different issues and confusion about obesity and health. The New York Times weighed in on this. This is an article about BMI, the standard BMI, and a picture, leave it to media. A picture is worth 1,000 words. The fat content in this person's body is obviously very different in the fat content, or at least in the body that they are portraying here. That's called the Schwarzenegger effect, and I've got a few patients with that. If you look at their BMI alone, it would show them as overweight or obese. And again, when you're in really good shape, you have a whole lot of muscle mass, that's not quite the same thing as having a whole lot of body fat. So again, those are different topics for different videos for later. What we're talking about again is, what if you don't manage your diet as well? What if you're not as disciplined as you'd like to be? What if you got a poor diet and you're overweight? What's the impact of conditioning? So let's get to that. First of all, what if your diet's bad? This was that article I referred to a few minutes ago. Oxford International Journal of Epidemiology. It's not I don't think it's a world-class journal, but it's not bad. Here was what they did. This was that ACLS study, Aerobic Center for Longitudinal study, 13,621 men and women. They did a 3-day diet record after a clinical exam and completed a second clinical exam between 1987 and 1999. They followed them for mortality until 2003. Here was the results. There was one primary diet pattern that emerged. It was labeled the Unhealthy Eating Index, and it was characterized by processed and red meat, white potato products, non-whole grains, added fat, reduced consumption of non-citrus fruits, what's often called the westernized diet or the typical American diet. No matter whether you're a low-carb fan or a plant-based diet fan or a plant-based low-carb diet fan, this is not it. This is the opposite. I think all of us would agree it's a bad diet. Now they put this in a hazard ratio. They put it in 5 quintiles, which is 5 different categories. The people eating the least of this unhealthy diet would be in quintile 1. The people eating most of it would be in quintile 5. There was a significant increase in hazard ratio or death if you were in 5 versus 1. In fact, if you were in 5, ate the most of this, you were 40% more likely to die than the people in category 1. So the unhealthy eating index was bad for you. But here's what's interesting about this study. This risk estimate was reduced by 13.5% and 55% after controlling for self-reported physical activity and fitness, respectively. In other words, if you just said, look, I do exercise, I do significant exercise, you had a 13.5% reduction in that impact of bad diet. That increased 40% mortality rate from bad diet. Now, if you said, wait a minute, no, I am in really good shape, over half of that increased mortality, that 40% increase, was wiped out. So, in the study terms or the scientific terms, in this study, the association between diet and overall mortality was, in large part, confounded by fitness. In other words, what they're actually saying in English is, you can wipe out over half of your dietary sins by staying in good shape. Back to Bambi Abel's comment, underlying the truth of that. Now here in the JAMA network, they talked about association of all-cause mortality and overweight and obesity using the standard body mass index. Actually, you know what? I should have talked about that back earlier. I skipped over it. I misread it. Here's the point behind this. This is some of the scientific lead up to this confusion about BMI. That's the science behind showing that, you know what, we need to improve our numbers and not just look at BMI. So that covers some of the confusing issues about standard versus adjusted BMI, bulimia, some of the other issues. And it makes the point, again, no matter if you eat really badly, if you get into or stay in good cardiovascular shape, yes, you will be healthier. You're not going to overrule or overdo the bad impact that you get from a bad diet, but at least you will mitigate it significantly. Now, this is a study that looks at your weight, long-term effects of changes in cardiorespiratory fitness and body mass index on all-cause and cardiovascular disease in men, the Aerobics Longitudinal Center study. So what we talked about just a minute ago was the same study, but it looked at diet. This study is looking at something different. It's in a different journal. The first study on diet and the ACLS was in the Oxford International Journal. This is on BMI, or whether or not you're too heavy, and the impact there. So again, this was 14,345 men with at least 2 medical examinations. Changes in fitness and BMI between the baseline and last exam over 6.3 years were classified into lost, stable, or gain groups. The hazard ratios of all-cause and CVD mortality were 0.7 and 0.73 for stable fitness and 0.61 and 0.58 for fitness gain, respectively, compared with fitness loss in multivariate analyses, including BMI change. Every 1 MET improvement was associated with 15 and 19% lower risk of all-cause and CVD mortality. BMI change was not associated with mortality after adjusting for confounders and fitness change. This is starting to get a little bit detailed and confusing. Let me just go to another quote, which is a little bit more understandable. Compared with men who lost fitness, men who maintained fitness had a 30% and 28% lower risk of death. Men who improved fitness had a 40 and 44% lower risk of death. So these remained after adjusting for BMI change. In other words, yes, you can be obese, and obese does increase your mortality rate. You die sooner. But guess what? Getting into shape and staying into shape greatly decreases that increased risk that you have from being overweight. So I've gone down a bunch of bunny holes and details, as I often do, and people say, bottom line it. I will bottom line it again. So there's evidence that having a bad diet increases your death. There's evidence that being overweight increases your death rate. Nobody's surprised about that. What's the impact of getting into or staying in cardiovascular shape? It greatly improves these two. Does it wipe it out? No, it doesn't wipe it out, but it can decrease that risk by over half. Thank you for your interest.